But with a hemoglobin over 100, you should pretty much be able to do normal things. And
Yes.
so that's not what's making you weak anyway. Now, is the blood condition itself where it's taking up some of your energy? Of course, we know that it's grumbling away in your bone marrow and your bone marrow is not helping normal. Is that taking some of your energy away? Yes, but giving you blood isn't going to make up for that, because that has to do with the actual metabolism of your body and how it's getting hijacked by the blood condition.
Yeah.
So that's kind of, without trying to get you back on treatment, I don't think we're really going to be able to kind of get ahead of that. So there might be some tiredness that's just purely related to having a blood condition in the background, and it is what it is right now, I think. But the counts are not that bad, and the platelet count is still pretty good. The platelet count had been really good early in the year. It was well within normal. In December, January, it's beautiful. And it's been, again, sort of trickling back down, although interestingly, it hasn't really dropped any further since about March. It's been sitting around 90 or 100. Again, any platelet count over 50 we consider pretty normal as far as how your body deals with any sort of clotting or bleeding. So
I'm very tired all the time.
yeah, I'm not surprised about that. You don't have very many white blood cells. Those never came back. Not really. And that's pretty typical of this condition too, because the blood cells that are the sickest usually in the bone marrow with this condition are the ones that grow up to become white blood cells. And if you just don't have enough of them, you're not going to have white blood cells. So fortunately, you haven't had a lot of trouble with serious infections, and that's great. Although sometimes, we have to be a bit careful, because sometimes if you're having weak spells, one of the most common causes of that can sometimes be urine infections. Now, usually people know because their pee is nasty, or it's burning a bit when they pee, and then they get the weak spell. So some people know, they come in and say, I got those urine infections again. But sometimes it's harder to tell. So, we always kind of want to make sure there's no sign of any
I
infection
had
if you're
urine
having that.
infections last year,
Yeah.
but not since.
Which is great. But, you are at risk of infection for sure. But the good news is you haven't really been having them. So some part of your immune system is still working very well, because you don't have very many neutrophils. And so they can only do so much. But there's obviously other parts of your immune system that are picking up the slack, because you haven't had infection after infection after infection, which sometimes happens.
Yes.
So that's the biggest risk for you right now. But the other side of that is that these don't just fight infection. These cells actually help your body to rebuild. So our bodies are constantly healing themselves. You go to sleep at night, your body is healing while you're sleeping.
Yes.
These cells are actually really active in helping your body to heal. So I do find that when people's neutrophils are low, even if they're not getting infections, they do feel more tired than when the neutrophils are better. But there's no real way for me to bring those up, because in your case, the injections wouldn't really work, because the injections are there to just kickstart the bone marrow. But your bone marrow, that part just doesn't work. So it'd be like beating on a dead horse, right? So I'm not really, that wouldn't really work. The chemo injections, we tried those. They worked great on the other blood counts, but not on the white blood cells, and that's pretty common. So I don't think that, even if we decided to try that again, I know that was not really on your plan, but if you decided to try it again, it might work on the red blood cells again, but I don't think it would work on the white blood cells. It just doesn't tend to. And I can't give them in an IV, for instance, from blood donors, because they're actually quite dangerous to give that way. And they only live about 10 hours, so you literally have to have blood donors just sitting there pumping, like skimming blood to give you those white blood cells. So that's why that's not really an option, because that's not really feasible. So there's no way for me to boost the white blood cells, unfortunately. Yes. And I think that's probably what's making you the most tired as far as your blood is concerned. So there's probably not much we could do about that. But the other blood counts are actually still pretty good. So I don't have to do anything with them yet.
Okay.
But I do think the tiredness is going to, and there's other things too. I mean, it's not just, you've had a few health conditions. This isn't the only thing that your body has had to deal with. So I think it's just a bit of this and a bit of that and a bit of something else. And, that is going to kind of wear down on you. I think being safe from a fall point of view is going to be the most important thing. But I'm not really sure if there's anything. I mean, I don't think it's your blood disorder that's making you fall. I'm just trying to think if there's something else that we should be looking for, but I'm not really sure what I would look for.
It's really frightening, because
I would say
I got such a bang.
Oh yeah, she did a real job on herself last time.
Yeah. My back is always pain. You know, just say I get up and sit in a chair. I'm all right for a little, just as soon as I get up to go to the bathroom, or just do any little thing. You know, just say I just tidy that up a little bit.
Mm-hmm.
I wouldn't be able to lift that phone, because if I did,
Mm-hmm.
it'll start, anything will make a pain.
So when do you fall? Do you fall any time of day or night? As if you get up in the night to move around? As if you're trying to carry something, or if you turn quickly? Like, have you had anything that
No,
seems to
every time
precede the fall?
Anytime I ever fell, it was in the daytime or morning, and there's always been around same places coming down across the dresser with all the handles on it,
Right.
or come down in the
So in the bathroom
In
the
the
last time, wasn't it?
bathroom across the handles in the vanity.
So no specific trigger you could think of, though. It's not after you've done your pee or moved your bowels. It's not after you eat or drink. Nothing like
No,
that.
I was ready last time to get the go bus. The go bus was waiting for me
Sure.
down by the door, and I was all dressed ready to go, and I just went in around the bathroom door for something or other, I don't know. And when I did, I went off of my head.
And I know you don't know if it's the blood sugar either, because you didn't take it right away.
I don't know what, the bathroom floor wasn't wet or anything like that.
Right. So it wasn't a slip. It was a whoop.
Yeah,
Do you feel sick to your stomach or anything before it happens?
no,
And you're on blood pressure medications, right?
but this past week I haven't got an appetite to eat anything.
Have you taken your blood pressure when you've had your falls?
Pardon?
Have you taken your blood pressure or your blood sugar when you had your fall?
No, but I get it taken every single morning and it's good. And I get one needle a day.
When do you get your blood sugars checked?
I get them checked about 9 or 10 o'clock in the morning.
And your blood pressure as well?
It's always good.
But you don't get it. These falls that you had that happened after you've had those things checked?
Yeah, because
Yeah.
you would be going
Because
out.
they can drop. So sometimes, for
Yeah.
instance, when you're first getting up and around during the day,
Yes.
when you're on blood pressure medications, and sometimes you did have a little bit of chemo, that can make it harder for your body to adjust. And what can happen is when you try to get up and around, your body can't adjust from going from this position to this position.
Yes.
So if you're having falls that are more likely in the morning, it could be that when you start to get up and around and you're more active, you might be having a dip in either your blood pressure or your blood sugar or both. But the only way to know is to check it when those incidents happen.
Now the last time you had a fall, she went to the hospital,
Okay.
and it's probably recorded there somewhere where she, when was that?
About 6 weeks ago or
Yeah.
something.
Because she went to the hospital and they did X-rays and everything on her.
I don't know, but it
Was
could be
that
3 months ago.
St. Clair's, I think it was.
I don't think I went the last time. When I went a couple of weeks ago, I don't think.
Yeah, you went to the hospital. I don't know if it was the next day, but that's because they called me.
Soft tissue swelling about the third toe. Yeah, I mean, I don't have a good explanation for the falls. I don't think they're directly related to the blood issue
Yeah.
per se. It's probably just not helping because it's probably taking even a little bit more of your energy. So you're going to have to be a little extra cautious. I guess one thing that's a thought would be to have a wheelchair backup until you're stable in the morning, right?
Mhm.
To have something like that on site, just even if it was for the first
Yeah.
little bit till
Now
you knew you
this
were
turns
steady on your
into a
feet.
wheelchair.
Right. So
Yeah.
maybe that's how you should be using it for the first hour or two in the morning till you know that you're steady on your feet. I don't know.
Yeah, because I don't go down for breakfast. He brings my breakfast up to me.
Yeah. Have you ever seen a geriatrician?
No.
So a geriatrician is basically an internal medicine doctor like me, but where I went on to specialize in blood, they go on to specialize in health issues that tend to plague older adults. So a lot of that has to do with things like falls, issues with high and low blood pressure, medication interactions, things like that. I wonder if that might actually not be a bad idea, because it could be that you're having some interactions of your medications. You're on, you've been on a lot of medication, but
Yes,
you've
I'm
had a
on
lot of
medication.
you are, and you've had a lot of health issues, and they're specific. Like what they do is they take a very detailed look, and they see if it looks like some of the things that you're having might be causing some of your issues. And the nice thing about it is, they do a consult the way that I do a consult when a new cancer patient walks in my door. So they look at it in detail in the way that a family doctor just doesn't have time to, because they're so buried all the time, right? They're so busy. And they're looking at it from the point of view of an internal medicine doctor. So they really look in detail at those interactions, and then they can give recommendations back to your family doctor and to you about ways to maybe make things a bit safer. So I think a geriatrician would actually be really helpful, because they'd be able to look at all those little dribs and drabs of things that might be causing trouble and give you some advice.
Because one time I was going out the door to pass something to somebody, and I was fine walking, and just like that I could feel my legs giving out underneath me.
Yeah.
In a second.
Yeah, I think that would be the best
Yes.
contact, just because they're so detailed and they're so good at what they do.
You can refer her to somebody.
I can. Yeah, I know that we've got 2 or 3 of them in town, and they're lovely. They're great people. Yeah, I know they're all young women, slightly younger than me, and so they were all having babies one by one. But I think most of them are actually back in the clinic right now.
Yeah.
But even if it takes a few weeks or months to get to see them, I still think it would be worth it in the long run.
Yes.
Yeah. So it's still worth getting you on that list. So I'll put a note to get that done for you. I'm just looking at your emergency room record just to see what the impression was for the docs there. Yeah, I mean, it sounds like their impression was probably similar to mine, that there was probably a few things on the go, because even just having the diabetes itself can cause muscle weakness, and the muscle weakness is actually often in the big muscles, your shoulders,
Yes.
the big muscles of your legs and stuff. So there may have even been, I kind of agree with them. There was probably a bit of a bunch of things that's contributing to your falls. I don't think it's like one thing, but it's getting a little bit out of my wheelhouse to know what to do with it. But I can certainly get the geriatrics
It's
team
because
to
I'm
take a
out
look.
walking down the hallway with the walker, and just walking away. My legs are fine.
Yeah.
And when you go, just like that,
Right.
you're gone.
Yeah.
Yeah.
Yeah. Okay. Well, let's see if they have any helpful advice as to maybe how to maybe make those episodes a bit less frequent. Because your counts are drifted a little bit and your hemoglobin does seem to be trickling down a little bit more the last couple months, I'm going to probably get you back about 2 months to take a look at your counts, because I actually go on sabbatical in the fall, and I'd like to have an idea before I go whether I think you're going to need to be back on a transfusion schedule. It used to be quite easy for us to set up because we did it through the clinic here, but since they kind of took all our cancer care stuff over to the cancer center, it's actually a lot more complicated to set things up. It requires a lot more steps. They're really good about it. It's not that they won't do it. They absolutely will, but it's a lot more complicated to do it. So it'll be harder for me to put it in place so it doesn't fall through when I'm off. So I'll have to make sure there's somebody who's watching that regularly for me. Normally I could kind of put you on a bit of an autopilot with the nurses here, but they don't let us do that anymore. So we are hoping that they switch that, because so many of our patients need transfusions that we need to have that system in place. So we are hoping that they let us put it back in place, but for right now it is not in place.
Look what happened to my hair when I had chemo. Turned snow white.
Oh, what was it before?
It was sort of a reddish color.
Oh, okay. I don't remember.
Now
Some of that was going on with Dr. Dunn, I think, so I didn't remember the change.
So right now, she doesn't need to change anything. Just
Not from our point of view. Like,
watch out for infection. So
yeah, that's the big one.
I think you should continue with the home to bring your meals into the room,
I think that's not a bad idea. I think
because there's 4 or 5 people at the table, and
yeah, Yeah, I mean, it's hard because you lose some of the social interaction when you're not getting out, so you kind of have to balance that. But, you know, you could still kind of choose to. It's hard if you're in a common dining area
Yeah.
where you're sort of surrounded by people.
Now,
It's harder to
seem like
control your
I'm
setting.
pretty good supper times, so I tries to go down and have my supper downstairs.
Right.
But
Yeah.
I'm no good for nothing in the morning.
Yeah.
Like
And
watching television.
fair
Right.
enough. Fair enough. So yeah, so I think, you know, I would just sort of carry on, just being very careful, making sure that nobody comes in with any infection. I do think with your immune system where it is and just everything else, you know, and actually probably what puts you as much risk as anything, even more than the leukemia, is actually things like the diabetes and things. That if you were to get one of these really bad bugs, I think it would be really hard for you to bounce back. So I think just avoiding any sort of infection in the first place. So anybody in the home is sick, steer clear of that area.
Yes.
Anybody in your family is sick, they don't get to come and visit. It's what
Yeah.
FaceTime is for.
Yeah.
Yeah, so I would just try to stay out of trouble. Keep getting your blood counts done at least once a month. And then I'll see in a couple of months and we'll see what the trend is over the fall and how closely I need somebody to be watching you for me. Okay.
Thank you.
And then in the meantime, I'll put in a referral to geriatrics. I think you'll get in within a few months. I do know they had a bit of a wait list, but last time I sent some over, it wasn't actually that bad. So, you know, I'll put it in as fairly urgent just because I'm concerned about your falls. And, you know, if you haven't heard at least of an appointment in a few weeks, call my office and Sherry can call around.
Yeah, because we don't want to have another fall.
What?
We don't want to have another fall. That was scary last time.
Yeah, no, that's fair.
Well, she was laid up like completely.
I was in bed for 3 weeks.
Yeah.
I couldn't even get into the bed. She was
And
in the
when
chair.
I'd say sit in the chair, when I'd have to go to the bathroom, it was horrible pain. You know, you tried to get in, you had to sit on the toilet and then come back and sit back. But when I got back and got into the chair, I just wanted to stay there. It was so comfortable.
Right.
Yeah.
So
Still-
that's good.
That's good you have a comfortable chair at least. Something
Yeah.
to be grateful for.
Okay,
So
thanks.
anyway, a bit of good news today. Anyway.
Yeah. So I think we're okay for now. I do think sometime in the next few months we might end up having to, you know, either get you on transfusions or decide if we're gonna brave another go at the treatment. But
Yeah.
we'll face that when we get there. For now, I think we're best just watching things.
Mhm.
Dr. Major said say hello to you.
Oh, very good. I saw him actually in the car the other day. I was walking downtown with my family.
Yeah.
My daughter did the Broadway camp down at the church down there,
Yes.
United Church, and so I was walking down there and I saw him. Gosh, I haven't seen him for a while. I
His
just
son
walked in.
is up working with us for the summer.
Oh, is he?
Yeah, looks just like him.
Really? Yeah.
Yeah.
Dr. Major's is sweet. When I was a resident, he was one of our favorite doctors to work with down there.
Oh,
'Cause he
he's
was always
sweet.
he was always so good to us and the patients. And,
Yeah.
Yeah.
Thanks.
Thank you.
See
Take
you.
care.
See you in 2 months. She sends stuff after us. Your turn now. See you later.
See ya.
Good luck to both of you.
Good luck. Hi.
It's nice to get talking to somebody.
Mhm.
Isn't it?
Yeah.
It's pretty good supper.
Yeah. Yeah. That makes me happy today.
We'll see.